The difficulty that we're encountering right now with the management and care of our patients with inflammatory bowel disease is that we're oftentimes waiting for our patients to get sick enough for appropriate treatment. And that's when we offer them the perhaps the most efficacious therapy. And this is unfortunate because far too often what we're doing is we're focusing on symptoms, disease activity in regards to assessing the disease activity, rather than the disease severity. And when we're talking about disease severity, we're talking about the actual natural history of the disease and the potential damage or complications and the disabling course that the disease could cause. So it's important for us to be able to figure out what the right treatment is, but we also want to understand who's the right patient for the appropriate therapy. And that's what we talk about when we talk about individualized, personalized medicine and applying that in inflammatory bowel disease. We need to be able to better identify who's at high risk as opposed to who's at low risk for disease progression. And this is where the personalization comes in. Recognizing one size, one dose, one treatment strategy doesn't apply for all. So how do I bring it all home? How do we put this all together? Well, to begin with, we need to identify and understand, does our patient have active disease? Yes, no. If it's yes, let's risk stratify. Let's base it off of these predictive prognostic factors. Are they at risk of a more disabling disease course? Yes, no. Now you need to reevaluate, recognizing one dose, one size of treatment, one approach isn't for all. So now we need to check levels and we need to optimize them. But we can't just assume that once our patients are on a therapy, it's going to work. So at this point, drug level monitoring is important. Evaluation to make sure that mucosal healing, we've used this word before as far as treat to target, knowing what our target is, what our endpoints are, has that been achieved? Yes, no. If yes, continue current approach. If no, it's time to reevaluate and change your approach, recognizing that this class or this treatment approach is not working for our patients. So, to put it all together, as a reminder, one size, one dose doesn't fit for all, and it certainly doesn't work with that approach in inflammatory bowel disease. We need to do a better job in predicting who our patients, the right patients are for the right treatment. We need to find the right treatment for our patients based off of what's more to come with research in the future. I predict it's actually going to happen where we can better risk stratify our patients, finding out how to better optimize our dosing, and then in the future of what's to come, actually having some of these decision support tools to utilize for our patient, recognizing we need to better tailor our care.